Good morning and good evening, everybody. Now today we have this masterclass with Laurie Hawkins from Australia. Well, in fact, from Australia is a big country, but it's on the east of, and is I think living in Bendigo, but is working in different areas. I will explain now. Who is Laurie? Laurie is a friend of ours, is member of InnoHealth Academy, and for a long time has been working in the area of data. He's one of the best experts I ever seen in my professional life. He's having a lot of data and is managing a lot of transactions in the National Health Service Directory. At the same time, Laurie is an advocate. I think is a man who is preaching how data can help healthcare, different kinds of data. And at the same time, he has a company. The company is, I don't know, I'm saying properly, AITIA Global, and he's the CEO of this company. And it says, I think, as an example, is the company says data is a single source of truth. Data, be unified. Anyway, thank you, Laurie, to be with us. I know for you it's late in the night now. For us it's early in the morning, but anyway, it's the only way to have the time to connect and to know what you can explain to us. You can add more at my presentation because you are the one knowing better what you're doing. But the idea today is the following one, is understanding how in Australia they are working in the area of digital health. And we know Europe, because Europe is more our base for everything, but we don't know what is happening in Australia. And talking to him, we decided to have this masterclass in order to make us aware of the challenges they have and how they work in this area so important for healthcare. Thank you all you are here in LinkedIn or in this area is WebEx room. And the idea is to have from Laurie what he wants to tell us, and after we have a time to put questions if we want to know more or we need to clarify some concepts, Laurie can explain to us. Laurie, welcome. The floor is yours.
Thank you very much. So this has been operating now for 12 years. It's called the National Health Services Directory, or outside of Australia, Health Services Libraries. And it is a library of health and social care services. And that includes public, private, and not-for-profit. Not only that, as you will see in a minute, it has over 300,000 healthcare professionals, all accredited. So it doesn't do anything, but it is a vast repository, which I will show you some of the things that it can do, just being a catalyst. So here in Australia, this information, 14 million transactions a month, discharge summaries, referrals, you name it, between GPs, allied health, all get sent across lines on maps. In Europe, I think a couple of years ago saw between Estonia and Finland prescriptions, 2,500. Whoopie-doo. I'm sorry, but you know, this is how you need to move into the 22nd, not the 23rd. We'll also cover off as well on, it's going to be good, just bear with me. So here is a case study of the Health Services Library. As I've mentioned, state and territory, 8 governments plus the federal government, public, private, not-for-profit. There are over 400,000 services. Services is a pharmacy, just one, and it goes on. And we divide that into 20 primary categories and around 200 subcategories. And as I mentioned, 300,000 accredited healthcare professionals, 14 million transactions, and hundreds and hundreds and hundreds of websites can all access the same database. So we remove the massive cost of having multiple silos everywhere, everyone trying to maintain their own information. And we have many, many users. Just as an example, we have, which I'll show you in the next slide, we have national call centers that use this information, and I'll show those in a moment. As a bonus, we also have access to the National Health Map, which is an advanced visual data analytics platform. And I hope to show you some of the different aspects of using data. So everything is in the cloud. There is no software required. So everything, you don't need an IT department. It's all managed for you. So as you can see from the cloud, I've just mentioned some of these: hospital EMRs, allied health, dentists, pharmacists, OTs, the list goes on. Once you have a single source of truth, you can have national templates, or you can have local templates. If you wanted to introduce, for example, a national discharge summary, simple. You just add it once and then everybody else can collect it. Simple. National call centers. These are just some of the ones. We have National Nurse on Call, funded by the federal government. If your little kid, little baby needs urgent attention after business hours, just ring National Nurse on Call and they will tell you, after going through, to say, go straight to hospital, call an ambulance, or this pharmacy is open at 10 p.m. at night, please go there and get your Panadol, whatever. We also have what's called the National Disability Insurance Scheme, which I believe Australia is the only one that has it in the world. I'll just say it's very expensive for the country. It is also the National Telehealth Directory, so that everybody knows that you can contact a pharmacy, a doctor, you name it, psychiatrist, and how they will talk to you. We take all this data because once you have one database, you can add in how many beds in that hospital, how many nurses in that hospital, and it can all be updated on the fly. Simple. For the whole country or a whole continent. This is like cookie cutter. If everyone takes the same version, you can then have interoperability across a group of countries. I've tried in Europe, but there doesn't seem to be any appetite for doing that just yet. Smartphone apps. I understand, at least in Australia, I could go across 8 government borders and know where a pharmacy is. When I'm a tourist, I don't need to go to the reception desk at the hotel and ask where the doctor is. And then there are all these other gateways, which I mentioned as well for you. And because we have an advanced data analytics, these are just some of the screenshots, which I will demonstrate as well. So let's have a look. On the left-hand side, cancer detection. We can show the best and the worst, and we can do it over multiple time years, and we even have trend. No other analytics platform can show you 50 years of data on one little trend. As an example, we've also done that for census data, and we've just, I hope to show you at the end, will be the WHO Global Exploratory Data, I think it's something like that. but we've done the most advanced implementation that you will ever see. And even they don't know that we've done it yet. On the right-hand side is COVID. So, and we'll show you some of that as well in Australia, in Sydney. And while we've got the physical numbers of cases, as you can see highlighted over here, I've also plotted where the aged care facilities are. So you can quickly, in an emergency, pandemic, tell everyone, shut your doors, whatever, just as an example. Here you have in front of you the mobile phone app. You just need 2 pieces of information, what service and what location. Very simple. Then you can go and have a look on the phone. Because it's Google Maps, Google Maps will tell you how to get there. And here you can see that we can merge data in many different ways, and I'll show you this in a minute. And you can see I've put in here Eurodis, Rare Diseases, Euraga, the ECH Alliance, Commonwealth Centre for Digital Health, Coral. We can do OEC, European Union, low-income countries. And not only that, there is much more that you can do. Data, just underutilized in the health sector. We have a tsunami of data and social determinants of health. Does anyone use it? I have yet to find anybody on a large scale basis from a global down to a postcode that can utilize that data. Here are just some examples of some of the data sets that we've done. As you can see, earthquakes and volcanoes on the right. Pollution. There is the Fukushima in 2011 and all the radiation. We can plot anything like that. Town and community planning. Oh, we need to put a hospital in there in 5 years' time. Why are we not planning instead of just being reactive? On the left, water resources. Very, very important. Population of our planet is growing. Unfortunately, the demands for water, especially water, are growing. And you can see frogs, believe it or not, at least in Australia, they're used as the environmental monitoring because they are very susceptible. And then in the top left-hand corner, you can see Hurricane Katrina and the watermarks and all the areas that they flooded, plonk, plonk, plonk. And we can even do videos. You can put in lots and lots of functionality, endless possibilities. So I'm now going to stop there and I will now share my screen and go to the website. I stop sharing the PowerPoint presentation, just bear with me. Right. I'll just share my screen again, everyone. What you see in front of you is the public access. Say public access. There are richer sets of information behind for service providers, health planners, etc., etc. And as I mentioned, you only need to have 2 pieces of information, and I'll do my own. Not only that, you can put in as many language sets as you want. We could do the whole of Europe from the same database. You can still have it at a country level, and you can still own the data. We just provide the facility. It's your data. We don't want it, but it's just how simple. So over here, and this is just some of the most requested services, but I'm going to use a GP. Now, here in Australia, I'm on the East Coast. On the West Coast, 3 hours behind me, so I think it will be 7:25. I don't know what the postcode is, but let's type in the curve. So let's go over there. Just 2 pieces of information. And one would like to think, and it's always, there you go. And it finds the first 50 or 30 in this case within the 4 kilometers of the post office within the local region. Actually, it's all closed now because I said it's 7:30 p.m. What you can see in here is I can get an appointment for Monday morning. Just click on it. And there you go. As I said, all the library does is act as a catalyst for other innovations to come and utilize it. So I can now go and book an appointment. And also, while we can hear, or this is just the public view, but it's also open tomorrow morning. Public holiday. We just close that up. It contains contact information, all publicly available. And then there's a map on how to get there as well. And if we look further on down, this is what they do. And you can see the names. It's up to the individuals if they wish to be publicly viewed. And the other services they do, flu vaccine and COVID. And you can also share this information with your friends, family, wherever they are. You can print it off, put it on the fridge, and you can see more. And a lot of the time, we shall have a look at another one. Let's go back. What I will show you is just, we have over 80 different languages. So you can actually find as an example, you can find a female doctor who speaks Mandarin after business hours. Not that I'm going to do it in here at the moment, but let's have a look. Or we can change that to a map view. And dots, and there it will come up, and then you can view the details, exactly the same. And get directions, billing. No, they haven't got any other languages. So now the next one that I'm going to show you are all the different services that are covered in a health services library. But as I said before, you do not start with a big bang. You only start with 4 public key data sets. Hospitals, they don't move. That includes private as well. Emergency departments, they don't move, based in hospitals. GPs, physical locations. And lastly, pharmacies. Just those 4 to start with. And then you rapidly build it out. But you also need to win the stakeholders. Unless you've got that, it ain't going to happen. Just from my personal experience. So, and I'll just go down the list. You can see the A's, C, cancer services, cancer support, children's nuclear medicine, children's sleep, Chinese herbal medicine. This covers health and social care, dementia, drug and alcohol, family planning, financial counseling. We go all the way down, hematology, pathology, hospitals, blah, blah, blah. And we go right down, don't think there's any Zs, but walk-ins, women's health clinics, etc. Another example, this is an Australian government, federal government health site specifically for pregnancy, birth and baby. And you can see that all these health services can be customized to what you want on your website. set and forget. They all go off to the same thing. Now, hopefully I can move this thing around. Well, that could be a good one. So what we do is an alternative. Just bear with me. This is the West Australia government website, Department of Health, and they've put in go and find a GP, and they come back to the map, and there you go, all the information down the side. Next link in. I can book an appointment tomorrow morning at 12:40. Or tomorrow morning at 9:20, as I've demonstrated to you before. You just click on whichever one you want. And here we have all the contact details, services, book now, public holidays, bulk billing, and what facilities, wheelchair access, etc., etc. And let's go and find another one. And I'm just trying to find to see if there are any examples we can find with for this one. Yes, here are all the doctors, general practitioners, etc., etc. Excuse me. Next available, and you can have different public booking engines. Sorry, so there you go.
Okay. One question, Laurie, if you allow me. When you move all this, I mean, you have access to doctors, GPs, babies, whatever. How is going my information? I mean, as a patient, for example, one day I go to one GP. Another day, because the GP is very busy, I'm going to another GP. How is going with my medical record?
The medical record here in Australia stays with whoever you see. But here in Australia, we have a national EMR. It's called My Health Record. It doesn't take how many, it just takes a discharge summary. For example, when a GP wishes to refer you to a hospital, on the GP software, in the background, uses an API to come to the National Health Services directory and grab the identifiers for that hospital. And that can be at a central intake, or it can be to a pathology lab. It's called the Endpoint Location Service, ELS. And I can do another session on the identifiers and all that. But they are 16-digit numbers. And we have what are called HIPPOs, Health Provider Identifier Individual, and HIPPO, Health Provider Identifier Organization. An organization can be just its name, it can be at a physical facility, or it can be at a service within that facility. And you add on the individual, and they will, two 16-digit numbers joined together, they will always be different, always. So you can send it to a central intake, or you can send it to the private hospital, or you can send it to the public hospital. And while that is going on, a copy of a discharge summary or referral is sent to My Health Record. Individuals have control on who can see it, but it is there, and there is an emergency override if it's deemed necessary. So a hospital may look at that as well. So does that answer your question?
Yes, thank you very much. Another question still, if you don't mind. I see the most GPs are private GPs. And how is working that? I'm paying the doctor, no, for the session. And after, who is paying that? How is working the money side?
So here in Australia, we have universal health care, and that is provided by what is called Medicare. However, the doctors can charge extra. There is a set fee, and then we call it bulk billing. So when you see over here, billing, mixed billing. If you have a health card as an example, then you only have to pay, you don't pay anything. And that protects the vulnerable. And then obviously, depending on if health insurance companies don't pay GPs, but they pay surgeons, private hospitals, etc., etc. So hopefully that will answer that question.
Thank you. Thank you. Very good.
So if it says, let's go and have a look. It says bulk billing only. That means they only take over here bulk billing. That means they only charge the standard thing. You won't be out of pocket expenses, as they call it. Okay.
Sorry, I have a question.
Far away.
No, the question is related to the telehealth service that you have in Australia. How familiar is the population with the telehealth service, or what is the level of usage of this technology? It is helpful, it is not.
We use it extensively, and many state governments are now setting up virtual wards, aged care. You know, it is used extensively. As you're probably aware, we have what's called the tyranny of distance. Australia is as big as Europe or big as America. And I was just hearing today, one community up in what we call the top end, fresh bread, over a journey of 1,000 kilometers just to get it to the community. So that's just one small example. So, but look, we do use it extensively, and Health Direct provide a national video service that doctors can use as well. You know, we use it extensively to ask you a question, and I'll show you a bit in a minute. Now, the last one I was going to, and then I was going to go off to the National Health Map, is the this is just the Health Direct, but this is the mobile phone app, and you can free health, blah, blah, blah. But Find a Service is another example that I was showing you a few pictures of before. So just to give you an idea, I can use my smartphone anywhere in Australia across 8 governments to find a pharmacy, GP, aged care facility, you name it, I can do it on here. Why can't any other country do it? I just wonder. And you don't have to do it at a country level, you can do it at a state level. You know, when other governments see the benefits, they want to join in. And we're talking about saving of money. As you know, the cost of maintaining the tens of thousands, or I'll say thousands of provider directories, massive cost. Okay. And what I'm now going to do is just arrange the next lot of the National Health Map. So we'll just go over to here, and we will, now, other countries have also found the benefits and the concept. Now, I have relationships with the company that I'm about to show you. This is Serbia's national public dashboard on their state of health. Why can't one state in Europe do that? Macedonia, Northern Macedonia also does it. This is in real time. You'll see it's Valentine's Day, but this is linked to but you can see all the appointments, requests, referrals, one day. And you imagine the data that sits behind all this to make use of in many different ways. They're smart cookies. Not only that, this is a media article that appeared in 2017 here in Australia about those two countries. And I'm not going to read it all out, but I will just highlight some of the stuff. And they have actually eliminated waiting lists. Eliminated. And allow me to show you just some of what was put in here. Some GPs, specialists in hospitals, use their own software, but they are fully integrated with the national platform. More than 100 third parties used by health are all integrated. Down here, in the space of 2 years, Macedonia rose in the EU from 27th to 16. Notice down here, there has not been any increase in the number of beds, radiology machines, everything. It's literally just more efficient administration that has doubled the amount of healthcare available at the specialist level. Not wanting to be outdone by its neighbours, Serbia put out a tender and deployed the same platform as I've just mentioned. The concept that e-health is going to take a long time is garbage. We need a country the size of New South Wales, 6 million people, in 6 months. So I'll just leave it at that. That is using the concept of knowing what assets you've got, what services they provide, and making more effective use of them. Based on that part. Now, I will show you the National Data Analytics platform now. I'll just get some presentation, some screens up. So that's good. And I'll just go through them all. I didn't want to overload the, it is our national, but it is also global. Spain could use the same software. Portugal could use the same software. The EU could use the same software. And I'll just use those three because I've got this in the way. So data, as I mentioned before, is the most underutilized asset in healthcare. So this is just a demo. It's been around for 12 years, hasn't been updated. Gives you an idea of the functionality and how quick it is. So this shows you all the physical locations of GPs across the Australian continent and Norfolk Island. And Christmas Island way out here. Oh, it's the Keeling Islands. If I want to see, that is in Sydney, New South Wales. That's how quick it is. Click on any one of these and you can get all the details. I won't do that today. Zoom back out. That's how quick it is. Boundaries. We have the capacity to take your data and manipulate it in many different views, even down to a postcode, if you so wish. And these are just some of the examples of different regions. Aged care planning is used by the federal government, home and community, federal government, Indigenous or First Nations regions, local hospital networks, as you can see up there. The modified Monash is based on how far you are from certain services. Hence why you will see it is extremely complicated. The traditional way of doing maps and showing data, any data, is what we call a heat map or chloroform. However, anyone can do that, but the challenge with heat maps is it masks data. Allow me to give you an example. So here we've taken census data, 2011, and this is what we call for First Nations as a percentage of total population. However, what you can't see are little red dots over here and down here and here. But if we use geobars, and we also have confidence indicators, how good your data, how confident are you of using it, relative errors, and we can do outliers, and I'll show you all this in a moment. But look, suddenly, like a sore thumb, that could be malaria, it could be cancer, it could be breast cancer, it could be you don't have to be a data analyst or anything like that. Now, here is the National Health Map, and you can see there are 7,197 physical locations as at today. This is updated daily, business days. And not only that, I can see who's open on a Sunday. I can also see who's open at 11. We go and have a look at 10 a.m. June. We're going to have a look at 7 a.m. Not many. Not only that, you can go to the Monash and have a look at Monash, or let's go and have a look at the state. New South Wales. There isn't many. You can manipulate data. We clear the data, and you can change it to let's have a look. Neutral blue, and see where all the psychologists are. Open at that time. Let's go and clear all these. Not specified. Not specified. And not specified. There are 4,068 physical sites for psychology, physiotherapy, pharmacy, and we could go down. We can go down to Tas, Victoria, City of Melbourne. So I can go down to the City of Melbourne, and I can go in, I can drill out, I can see a hover over it, and then I can click on it and get more information. You can do multiple data sets all on the same platform. Now, I'm very quickly just going through some of these because there's some other stuff as well. I'm conscious of time, so I'm just going to clear that. And this is all data from the National Health Services Directory. Here are the primaries. And if we wanted to see where optometry, is there any? Yep, there we go. And then you can go off and look at cancer services, breast screening, I don't know, 30. Peter Mac is one of them. I think, yeah, Epworth Private and St. Vincent's breast screening. There is so much, and look, I haven't got the time to be able to show you all of what's in here. But
Laurie, one question. Sorry to interrupt you.
That's all right.
For example, I want to go to a hospital now, night, evening, because my son, whatever, has a problem. Where I can go, where is less a busy hospital, emergencies.
Now,
How
we don't do that, but the state governments do provide dashboards individually. That is not linked to this directory of data. It is just data. It doesn't do transactional data.
Okay.
It does not hold any personal data, no patient data whatsoever, but it facilitates the movement.
Okay.
14 million transactions a month. I hope that's federal government provides this, but the state and territories are responsible for each of their own healthcare systems within their jurisdiction. Now, here is COVID. We tried to get the WHO and various other organizations, but nobody wanted to know. And as you're all aware, the WHO and many other organizations, they display their data in how big a circle it is. Well, that mass data. So this is our view of the world. And this goes from the 3rd of January, and we populated this every single day from the WHO publicly available data. And you can also see we have US data from the Johns Hopkins, and there are some information from the various state governments. Now, the reason I've taken a snapshot, and a snapshot over here, share bookmark, I can take a snapshot and I can embed that into a PowerPoint, or I could come straight here, it doesn't matter. Now, as you're aware, just to show some functionality, everything is configurable by yourselves. Go to the label, display the value, and put it on there. What you are seeing here is the daily totals. We can have deaths, but the physical count, the population, so we get same data, but we are seeing data per 100,000. So it averages it out, not just because you've got the most, or, and this is very unique, we successfully indicated, not predicted, not using that word, but we successfully indicated every single wave. Now, just as an example, there is a trend chart for all the data for COVID. You can actually see at a glance all across Europe. I'll go to Spain if I can get it. Yep, there's Spain, Portugal, all at a glance, publicly available, France, etc., etc. Now, I'm on the 23rd of November 2021. The reason I've come here is South Africa announced the next day Omicron. Now, you can also download the data as well, but I'm just going to go forwards, and that just shows you in bar charts. Doesn't matter where you are, but I'm going to go back here, and I'm just going to advance one day. This is how fast, and sugar, look, you can see over here, South Africa, 9.9. We, after I understand that this planet still does not have a pandemic tool that they can use by everybody. We have it, it's available, just need to put in the data. That data can be put in on the fly. Everyone can use it. We can even do vaccinations. We've put vaccinations in here. I could have told you that Israel was one of the first movers. Dying Freddy could tell you, looking at other countries, it was a waste of time and it was not working as it was hoped, unfortunately. Let me just show you how quickly it's going to spread. So 24th, oh, go back to that one, sorry, go back to the day. And the way that we do it is we take a rolling 5-week average, not a rolling 7-day forecast or 14-day forecast. And we take 7 days, 5 weeks ago, and analyze it against the next 4 weeks or the last 4 weeks. And you'll notice the color chart, good, fantastic. Red can go up or down, increasing, you're in deep doo-doo. And if you look over this and all the countries across the planet, you can see it starting to spread, and the more reds it gets, and you can start to see it going across 11.9, not good. And I can show you even down to a county, and it just advances in days. And you can see in Europe, it's starting to get good again. Give it a 3 or 4 weeks, it starts off again. And you can look in, I think it's Libya, per population. Oh, Zimbabwe. So I can then put it into a bar chart. I can go up to here. I can make a video in 2 minutes and publish it on the web. That's simple. I'm just going to go up to here, get rid of this, and get rid of the values. Everything is configurable by yourselves. Bar chart options, group count, group type, and we can get rid of, we can see just the highs and the lows. And this is for any data, not just COVID. So there you go. And what I'm just now going to do is go to the US data, John Hopkins, just zoom in a bit. And as you can see, these are states. You can do it by county. 3,000 data points. If there's nothing in there, that means they haven't done anything. I'm going to go to daily totals. And what we will do is go to our traffic light system. Oh, cool, bang. Let's go to the chloroform map. It looks a bit better. And you can see, no, COVID hasn't arrived yet. But around Christmas time, when everyone starts to travel, and I'm just clicking the button, and you can see how fast it's loading. And I think you will see in the Eastern Seaboard, it then starts to creep by county. And you could actually see how many deaths were reported. You could go down to a hospital level. You can go down to how many nurses of the world is available. But nobody wants to invest. Christmas Day. And then we've actually done the social vulnerability index of the US. And anecdotally, I'm not saying it because I'm not a data scientist, but anecdotally, 4 areas down in the southern states. I haven't shown it on here, but they were more affected. And as you can see, just how bad it gets. And the bigger this gets over here, the worse it gets, or it starts to get better. And you can see how it suddenly takes off. And you can do a trend chart, San Bernardino, you know, everything is possible. This could be malaria across the world. It could be AIDS. It doesn't matter. The world can have a single source of truth for all data. You can slice and dice it, cut it off to your country. Oh, you can put security over it. And just one last thing, and I'm not going to have time to show you all our other stuff because we're rapidly coming out of time, which I apologize for, but I hope it's been of value.
It's okay.
I'm just going to go back to Australia, and I'll just give a quick example. Let's go back to clear locations, Australia, and you can see there, and let's go over here, make it a bit hybrid map. And there is a hybrid map. Now, up here, you can move these, you can tick a box, you can make your own maps. But up here, we have, or you have, the capacity to add in personally identifiable information or your cancer patients for a hospital in your location. But it does not go into the cloud. It does not go on the internet. It stays in your browser only. Okay? Your privacy is maintained. So if we go and add this over here, and you can see any data is not uploaded over the internet. It is all performed on the browser in your device. And we look for a latitude, longitude, or a suburb, or a state, or a postcode. Most information, most data has one of those. Now, I haven't got this, hopefully we will see this in a moment, and I'll just move this over here, and I'm just looking for a file, which I hope I can find soon. What I'm about to show you is where all the toilets are in Australia, if I can find the file. And I'm probably not going to be able to find it tonight. But this was an example of oh yeah. I will just show you some of these. Oh, I don't think I'm going to be able to find it. No, it doesn't look as if it is. Ooh. Now, my apologies, I'm not going to be able to find it. So it looks like I've been moved for lack of time, but that's all good. And I'm happy to come back if you want to have a session or more on data, what we're doing with, as an example, COVID data. Not COVID, sorry, census data. Here in Australia, we've taken the last 5 censuses, merged them all together. The census in most countries is used and the data is just left because they can't bring them together. Well, I can show you a benchmarking, and if it is allowed, I can just show you a couple of what we call and the child index. And am I allowed to have the screen again? Am I still sharing? Can you see the screen?
Yes, yes.
Oh, good. Fantastic. Oh, golly God, never worked when you want it to.
Listen, perhaps the time. Perhaps I
look,
wonder,
I'm sorry.
in between, if somebody wants to make any put any question or comment on that.
What you can see in here is the child early development census for the last 15 years, 2009, and you can see 2 or more domains, the Tiwi Islands,
No,
and
we
you
cannot
can
see
see.
that. Laurie, we cannot see that. We see the
My
format,
apologies. So that's
the
all right.
format
I'll stop
slide,
sharing.
No. It's, I think this is one there, and it's not possible to see the new one.
Now look. Oh, that's all right.
May I ask you a question? I think it's quite amazing what you achieve from data or by data in Australia, the kind of central system capable to have all the information and how to update it at date, because the most important thing here is not data you have, is how this data is updated. But if you look at the future, what do you think it's important in Australia for the future about digital health? Which kind of challenges or which kind of plans do you think necessary to improve in Australia?
I'll say politics and politicians. It always comes down to what is the most. We have spent here in Australia $60 million to an organisation that has not utilised this platform. And I can show you many other platforms and data analytics. And look, I haven't shown you a fifth of what you can do, but unfortunately it comes down to politics and people of influence on how or what they do. Money talks, as we all know. So I'll just leave it at that. The tools are available, just needs leadership to make use of all this data and plan ahead. Healthcare, as you're all aware, in most countries, you don't plan ahead. It's normally reactive. Blind Freddy can tell you that I shouldn't say that, but we're an aging population across many countries of this planet. So that means less people to work, and we've known about it for years. That's why we do censuses. Has anyone actually done anything about it? I'll leave it at that. Hopefully that.
Well, it's the same questions in Europe and in Spain, in Catalonia, the same questions. Depends about leadership, vision, and how we can use technologies to make things better. But anyway, I think I am bored of the time. Any question for other people from other? Tony?
Just Laurie, we are lucky because we have here fantastic politicians. So this is a joke. We are in we have the same problem. No, I was curious about the tool when you show us the world when talking about COVID pandemic, and this tool is what tool is using? For example, the World Health Organization. For example, is using a tool.
I understand. they have got you have to press a button, press a button, press a button, press a button, press a button. I don't know what the platform is, but it's absolutely a joke. You know, but unfortunately, if you try something new, you may put people out of work. And I'll just leave it at politics.
But anyway, thank you for the chat. That was really, really inspiring. I think it's amazing what you are working on, amazing that your vocation on data. And for me, the message you are giving to us is saying, if we're not working well with data, we cannot improve healthcare systems. I mean, that is the message we learned from you. And yeah, I think the challenges are the similar challenges we have. And as you said very well, that depends not only the technology available now with the AI, about ChatGPT and company. The problem is how we use these tools and how the leaders of the system is able to manage the whole thing and making people aware, clinicians and patients. The future has to be different. We cannot go on at this like now. That is for sure. Okay.
Just two things.
Tell me.
Countries need to know what assets they got. They don't even do the basics. AI is fantastic, and it certainly is advancing. But why can't you on your phone find a doctor that's open in the next country in this day and age? You can look on Google, but Google does not curate, doesn't check its information.
Yeah.
And if you would like me to do another session just on the health map and the global world health data, census data, early childhood, what we've done.
Thank you for offering
More
that.
than happy. Thank you. Whenever, if you wish.
We contact you and to see from our team with these kind of things we need to know more, as you said now. Okay, thank you very much for your time at this time of the night. Sleep well. We are not sleeping now. Is the weekend coming soon for us? And in any case, thank you very much again. Thank you for all people around. Thank you, Emily and Paul, the IT people making possible this connection, and all people in LinkedIn too. Thank you to be with us. And of course, Laurie said, if any question, we have the LinkedIn address, and anything you need, please let us know to him. He will answer the questions. Anyway, thank you very much and see you soon.
Thank you, everyone.
Thank you very much.
Bye-bye. Thank you.